15, a short clinical discussion for internists, PGs, practitioners, and research field workers. Today, I want to talk in short upon the management of knee joint osteoarthritis, Jana Sandhi Shula. Very common in OPDs, very common in IPDs, very common in the market. Lot of potential is there for the service giving people for knee joint pain. Who doesn't suffer with knee joint pain in nowadays? Every young adult, adolescent, elder, male, female, all will suffer with this knee joint pain. Knee joint is a weight bearing joint in human body. Knee joint is made up of three important bones: femur, tibia, fibula, patella. Knee joint has got many structures like meniscus, cartilages, cruciate ligaments, bursae. How to understand treatment of osteoarthritis of knee joint? Osteoarthritis is uh, simply telling it is inflammation and degeneration of knee joint structures. So anything which causes infection, inflammation, degeneration causes osteoarthritis. Sandhi is Shleshaka Kafasthana, and in Shleshaka Kafasthane Vatadushti is Samprapti. Kapha Medas Ama Avrta Vata, Raktavrta Vata, Asti Avrta Vata, Majjavrta Vata can be one of the presentation cause for knee joint osteoarthritis. Osteoarthritis in general, when a patient comes to you, do inspection, palpation, percussion. Minimum knee joint X-ray and maximum is MRI scan. Blood investigation includes inflammatory markers CRP, ESR, HbDC, DC, RBS, and calcium, vitamin D3, B12. If knee joint is having Ushna Sparsha, it is Sama Sandhigata Vata. If it is not having Ushna Sparsha, it is Nirama Sandhigata Vata. If the joint is degenerated, osteosclerosis, osteoporosis, then osteopenia, then it is Dhatukshayajanya Sandhigata Vata. When osteophytes are seen, it is also Dhatukshayajanya Sandhigata Vata. In practice, we come across in our OPD, IPDs or general consultation rooms, Stula with knee joint osteoarthritis, Krusha Dehi with knee joint osteoarthritis, postmenopausal osteoporosis women are perimenopausal, premenopausal, postmenopausal women with knee joint osteoarthritis, Abhigatottara knee joint osteoarthritis, Snayugata Vata leading to osteoarthritis, anterior cruciate ligament and posterior cruciate ligament can have partial rupture or trauma. Jana Sandhi Sramsa, subluxation of the knee joint can be seen in the lateral part of X-ray of knee joint. Subluxation, Jana Sandhi Sramsa. If the hamstring group of muscles, supporting muscles of the knee joints have stiffness, then also knee joint pain comes. Then osteoarthritis of knee joint can be different for person's general strength. Shula Pradhana osteoarthritis, Stamba Pradhana osteoarthritis, Sankocha Pradhana osteoarthritis, Sandhi Atopa Pradhana osteoarthritis. Like this, a beginner internee should report a patient of Jana Sandhi Shula. Only 2 lines of Sandhigata Vata Lakshanas are explained in Samhita. Tatra Sandhigate Anile Prasarana Akunchanayoho Pravrittischa Sa Vedana Vatapurna Dhrutisparshaha. This much we get in discussion, and treatment is Snehana Svedana. Svedana first and then Snehana, or Snehana first and then Svedana, because it is Vatavadi. If it is Kafameda, Ama, Shrota Pradhana, Snehana should not be initially started. Lepa, Praseka, Parisheka, Upanaha should be, Svedana should be done first and then Snehana. If patient is not having a warm to touch Ushna Sparsha is not there, Samadosha is not there, then after Rukshana, Snehana Svedana should be done in Sandhigatavata. I'll make in short, what are the Bahiparimarjana Upakramas? Many small Upakramas are very effective in Jana Sandhigatavata. Bahiparimarjana Chikitsa like Lepa with Rasnadi Churna, Nagara Churna, Nagara Ashwagandha Churna, Nagara Ashwagandha and Gomutra. Shunti Churna, Ashwagandha Churna and Gomutra you mix. Chakradatta reference. You apply over the affected area. When you examine, please be specific. Knee joint, when you are examining the patient, medial side pain, medial meniscus is involved. Lateral side pain, lateral cruciate ligament is involved. Inferiorly, the meniscus is involved or superiorly meniscus is involved. So, suprapatellar bursitis or infrapatellar bursitis is differential diagnosis for Kroshtaka-Sirsha. Janu Madhye Mahashotaha is Kroshtaka-Sirsha. So Janu Lepa can be done with Jatamaya Churnam, Kottam Chukka Churnam, Dashanga Lepam, Doshagna Lepam, Shotagna Lepam. With Gomutram Chinchajalam. With little quantity of Gruta can be given. Next comes is Seka Parisheka Dhara. Dhanyamla Dhara, Kwata Dhara, Gomutra Dhara can be done on the knee joint. Next is Upanaha Svedam, Jalokavacharanam, Viddagni Karmam, Agni Karmam and application of simple plaster available in the medical shop. Belladonna plasters are available. If patient is having Shota Pradhana Janashula, apply 2 belladonna plasters right and medial side. Patient feels better. If patient is having Nirama Lakshana, Bahiparimarjana, Uttama Chikitsa is Janu Basti, Janu Tarpana, Janu Pichu, Janu Abhyanga, Janu Dhara. If patient is having Nirama Avastha, Janu Abhyanga is very good. For Janu Abhyanga, if patient is having Kapha and Vata Lakshana, Karpuradi Tailam is very good. If patient is having Kevala Vata Lakshana, Prabhanjana Vimardana Tailam is very good. If patient is diabetic and having Janashula, diabetic knee joint osteoarthritis, then Dhanvantara Tailam is good. If patient is having Abhigata history and Abhigatottara Jana Sandhigatavata, Murivenna Tailam, Kottam Chukkadi Tailam, Brut Saindavadi Tailam are good. And if patient is having a history of fracture followed by that there is Janashula, treatment done for fracture, then Gandha Taila Abhyanga is very good for treatment. So selection of Taila is very technical in Ayurveda. Mixing of 2 or 3 Taila means there is a confusion in Vaidya's decision making. If patient is fit for Shodhana, when Kaphameta Savrtavata, Staulya, Medo Vriddhi Lakshanas are there, Virechana karma should be done. Snehapana with Gugulu Tiktakam Grutam or Snehapana with Varnadi Grutam or Snehapana with Panchagavya Grutam should be given for 3 to 5 days and then Vishramakala and Virechana. Virechana with Gandharvastadi Eranda Tailam, Eranda Sukumaram, Ichchapedi Rasam or Abhaya Modakam can be tried. Because it is a Vatavadi, it is not requiring Pravara Shuddhi, 30 Virechana Vega is not required, less than 10 is also effective. You can also think about Koshta Shodhanam with 30 ml of Gandharvastadi castor oil with warm milk. Payasa Eranda Tailam is the Chikitsa Siddhanta for Vatavadi. So you can give directly Koshta Shodhana or the Eranda Taila mixed with milk, warm milk. After Virechana, Yapana Basti is very good. Either Yapana Basti or Niro Basti. I prefer if Shota Pradhana Samprapti was diagnosed, then Eranda Muladi Niro Basti and Dashamula Taila Anuvasana Basti. If patient is having Ama Lakshana, then treat Ama Dosha and then Baladi Yapana Basti or Madhu Tailika Basti. If patient is having diabetes, osteoarthritis, then Madhu Tailika Basti. In Madhu Tailika Basti, Madhu and Taila are equal quantity. 200 ml of Madhu and 200 ml of Sacharadi Tailam, Bala Tailam, Mahamasha Tailam, Dhanvantara Tailam can be used, or Amrutadi Tailam can be given. 200 ml of Gruta and 200 ml of honey and 200 ml of Taila should be added in 15 grams of Saindava Lavana. Kalka is Shatapushpa Kalpa, Rasnadi Kalpa, Rasonadi Kalka. And 1 tablet of Brihadvata Chintamani can be added, or 1 tablet of Yogaraja Gugulu, Maha Yogaraja Gugulu, Swarnama Yogaraja Gugulu can be added in Niruha Kalka. and Gomutra Prakshepa can be given if patient is having Kafanubandhi, Medanubandhi, Shota Samprapti Lakshana. If patient is having Dhatukshaya, osteoarthritis, osteophytes, osteosclerosis, osteopenia, then Kshira Avapa can be given or Yapanabasti can be given. Kashaya is Erandamula Kashaya, Dashamula Kashaya, Nirgundi Kashaya, Balamula Kashaya can be added in Yapanabasti. And after Yapanabasti, Sira Veda should be done. Shamana Chikitsa is very important in OPD base. Gugulu Kalpa is not the prime prescription for osteoarthritis of knee joint. Actually, Gugulu Kalpa should be one of the option for knee joint osteoarthritis. Other than Gugulu Kalpa, I was talking about if Kapha is Anubandha, Kapha is Sheetam Snignam, Vata is Ruksham. So in osteoarthritis, Ruksha Vriddhi, Kafakshaya, Astikshaya Lakshanas are there. So Katu Ushnam Brahmanam is line of treatment. Katurasam, Ushnam Brahmanam. Katurasam, Ushnam Brahmanam is Lashana Grutam, Apara Lashana Adhigrutam, Lashana Yamakam, Lashana Kshirapakam, Lashana Ballataka Kshirapakam. Either Lashana Kshirapakam or Bhallataka Kshirapakam can be used. Varanadi Kashayam, Rasna Erandadi Kashayam, Kokilaksha Kashayam, Punarnavadi Kashayam, Amrutottara Kashayam, Kokilaksha Kashayam, Dashamula Kashayam. These are all very good for Katu Ushnam Brahmanam. And Krushe, Vidaryadi Kashayam, Dhanvantara Kashayam, Kshirabala Shatapaka Tailam, Gandha Tailam. In Sthule osteoarthritis, Gomutra Haritaki, Dashamula Haritaki, Gandharva Hastadi Kashayam, Gugula Tiktakam Kashayam, Kottan Chikkadi Thailam can be used in Sthula osteoarthritis. Rasayana Chikitsa holds very good. There are important prescriptions. Rasnadi Kashayam, Maharasnadi Kashayam, Rasna Saptakam Kashayam, Rasna Panchakam Kashayam, Rasna Dashamula Kashayam, Rasna Gugula Kashayam. So all can be used based on particular Samprapti Ghatakas. Rasna Saptakam is Shula Pradana Aushadi and Rasna Dashamula Kashayam is Shota Pradana Aushadi. Rasna Erandadi Kashayam is Vatanulumana Pradana Kashayam. Maharasna Yoga Raja Gugulu Kashayam is Shota Vedana Shamaka Kashayam. Erandamula Pippali Chitraka Churna can be given as Rasayana. Shilajitu Rasayanam, Shilajitu Gugulu, Shilajitu Vatakam can be used as Shilajitu Rasayanam. Now in the market, Shilajitu is booming. Loha Shilajitu is also a good choice to choose. 5 grams Loha Shilajitu with warm milk can be used. Eranda Payasam. Eranda Bija Payasam is one of the best drug, and Eranda Bija Arohana Krama Chikitsa is also tried. You can take Shodhita Eranda Bijam and increase every day 1 bija to 10 days and decrease 1 bija for 10 days. 20 days Eranda Bija Vardhamana Prayogam. Kevala Shuddha Vatsanaba Prayogam. Vatsanaba is also one of the better Rasayana for Sandhigata Vata. Another Rasayana is Karaskara Rasayanam. Karaskara Vati, Karaskara Girtam, Karaskara Kshira Pakam, Karaskara Siddha Kshira Basti. So Karaskara Prayoga becomes one of the pioneer prescription for Shula Pradana and Vata Pradana, Jana Sandhigata Vata. And Ashwagandha Rasayanam, Ashwagandha Kshirapakam, Ashwagandha Grutam, Ashwagandha Taila. In the market, Avartita Ashwagandha Taila 6 times is available. Ashwagandha Kshirapakam, Ashwagandha Tailam, Ashwagandha Dileham can be used in osteoarthritis. Majun Suranjan is one of the Unani drug. Majun Suranjan is also one of the best Rasayana Brahmana Unani Kalpa can be used. And then comes is Ajamamsa Rasayanam. In some of the patients where Mamsa Shosha Lakshana is there, Snayu Shoshana, Mamsa Shoshana, Tarunasti Shoshana Lakshanas are there in Jana Sandhigata Vata, then better prescription is, if patient is non-vegetarian, Ajamamsa Rasayanam, Mahisha Dravakam. These two are Mamsa Rasayikta Prayogam. Mahisha Dravakam is one of the Dravakalpa, which is Mamsa Tarpanam, Brahmanam, Shosha Haram and Sandhi Sthairakaram. Whenever you want Sandhi Sthairya, 2 important drugs, one is Karaskara and another is, if patient is affordable, Hiraka Basma Prayogam. That should be done. because the molecular integrity of phosphorus metabolism can be corrected by Hiraka Rasasindura Prayogam, Hiraka Vishamushti Prayogam, or Hiraka Bhalataka Prayogam, Hiraka Rasayana Prayogam, and Ilajitu Rasayana Prayogam, or even you can plan about the Jyotishmati Rasayanam. Jyotishmati Rasayana is also one Rasayana to be used in Vatavyadi Chikitsa that can be used. And Shallaki becomes one of the best rasayana for knee joint osteoarthritis. Shallaki is Vataharam, Kafaharam, Shotaharam, Shulaharam. Analgesic, anti-inflammatory, and neuroprotective. So you can use Shallaki Ugulu, Nirgundi Shallaki Ugulu. I remember Nirgundi Shallaki Ugulu was taught to me by Dr. R.R. Bhatt and his son Dr. Sripati Bhatt from Udupi. This prayoga was done. And Gomutra Dashamula Ganavati, Gomutra Nirgundi Vati are also very good for knee joint osteoarthritis. Erenda Bija Payasa, Erenda Bija granules can also be used. So, in osteoarthritis of the knee joint, three important aspects today we have discussed. Number one is diagnosis according to modern science with X-ray, MRI scan, and along with that, diagnosis of ligaments, tendons, joint effusion, and meniscal tear or medial meniscus inflammation and degeneration. And then comes is markers for inflammation, C-reactive protein, PTINR, ESR, any post dengue cases, post chikungunya cases, post rheumatoid arthritis cases. We come across post chikungunya and inflammatory knee joint disorders are very common. And I have seen even after 10 years of chikungunya, knee joint degeneration is very common. Cytokine storm due to COVID-19 is also one of the cause for early degeneration in young adults who are non-obese. And then comes is diagnosing with vitamin deficiency, B12 deficiency, D3 deficiency. Accordingly, the treatment should be selected. And if patient is having very clear-cut samprapti ghatakas should be made in knee joint osteoarthritis, like stula and knee joint osteoarthritis, krusha knee joint osteoarthritis, history of abhigata and knee joint osteoarthritis, history of jora, dengue, malaria, COVID-19 or chikungunya, all category of inflammatory joint arthropathies, autoimmune disorders and knee joint disease, and rheumatoid arthritis, primary rheumatoid arthritis and secondary osteoarthritis of knee joint is also very common. In that case, dhatu kshayajanya sandhigata vata chikitsa, as I told, virechana followed by yapana basti are very good. If patient is having bone mineral density decline, even in 27-year-old people, we are seeing bone mineral density declines, Z score is raised. In such case, sagrita tikta kshira basti, panchatikta kshira and panchatikta vrita basti, estimadu kshira, estimadu grita basti, or even guduchi siddha kshira, guduchi grita basti, sacharadi taila and guduchi siddha kshira basti, yapana bastis, erandamuladi basti, mustadi raja apna basti. Basti chikitsa should be done once in 3 months to all osteoarthritis patients. Then only you are able to maintain the degenerative tissue replenishment effect. And Shamana Yoga Gugulu Kalpas are when inflammation is seen, Trifala Gugulu, when patient is having Vatarakta Samprapti, Kaishora Gugulu, if patient is having Shota Samprapti, Nirgundi Shallaki Gugulu. If patient is having Amavata Samprapti, then Simmanada Gugulu. If patient is having degenerative changes, then Sallaki Gugulu and Abba Gugulu, and even the Laksha Gugulu. When Asti Sandhanakrit effect is affected, Laksha Gugulu improves the Asti Sandhana and osteoporosis. Don't mix 2-3 Gugulus, powder them and give. Instead of that, clearly give good dose of any one Gugulu Kalpa. Initially, I give Simmanada Gugulu to reduce the Shota and Srava. Then Shleshaka Kapha is Apmahabhuta is decreased. Then we give Shilajitu Gugulu. Then if patient needs Sandhana, osteoarthritis, osteophytes, then you can give Laksha Gugulu. If patient is having inflammatory arthritis, Abha Gugulu. Trayodashanga Gugulu, if patient is having concurrent knee joint osteoarthritis with lumbar spondylitis, JK syndrome I call it as, Janushula, Katishula together is a syndrome contributed by me called Janushula, Katishula syndrome or JK syndrome. I'll take discussion on JK syndrome in some other class. And if you want to give patient a very stable Sira Balya and Snayu Balya, you want to improve vascular and muscular integrity, Kanchanara Gugulu can be given. Hypothyroidism, obese and knee joint osteoarthritis, Kanchanara Gugulu. Old age and osteoarthritis, Kaishwara Gugulu. Patient is having Sira Kautilya, Uttana Siragata Vata and then Kaishwara Gugulu. Like this, Gugulu Kalpas can be very well prescribed. Patyadi Gugulu, if patient is having Rudrasi with knee joint osteoarthritis. And in Rasayana Kalpas, I conclude Shilajitu Rasayana, Karaskara Rasayana, Erenda Bija Rasayana, Vatsanava Rasayana, Shilajitu Rasayana are very important. However, whatever treatment you are doing, along with us, try my explanation, and this explanation is not for non-medical people. This is only for registered Ayurvedic practitioners, students, PGs and Ayurvedic research workers. Any layman is hearing this lecture, it is only for knowledge, not to do self-remedies or self-medication. Patya along with osteoarthritis is, you should give Kshira Pradhana and Ghruta Pradhana Brahmana Aushadis, Kushmanda Rasayanam, Kushmanda as one of the vegetable, or even milk as one of the source of food is very good for knee joint osteoarthritis. Apatya is any Amakara Ahara Vihara, Shita and Snigdha Amakara Ahara Vihara should be avoided. Yogasana is very good to strengthen the muscles of the knee joint, and Yogasana improves the flexibility of the knee joints, provided when osteophytes are very strong, then you should not do knee flexion more or Vajrasana like asanas. When knee joint space is reduced, you should give Mamsa Balya, Nara Balya or Nadi Balya Aushadis, so that Karaskara Rasayana can be one of the better choice when knee joint space is reduced. With this, I think we have discussed a very important aspect of knee joint osteoarthritis. If any questions are there, we can take one or two. Otherwise, thank you one and all. See you day after tomorrow. Tomorrow I am out of station, so I will do day after tomorrow. Thank you.
Sir, namaskara. Sir, namaskara. One question.
Hey.
Sir, ಅದೇ ಈಗ ರಿಪೀಟೆಡ್ ಆಗಿ ಆಮ ಆಗ್ತಾ ಇದೆ ಸಂಧಿಗತ ವಾಸನೆ. ಸೊ ಅದಕ್ಕೆ ಬಲ್ಯವಾಗಿ ಏನ್ ಮಾಡ್ಬೋದು ಸರ್? ಆಮಹಾರವಾಗಿ ಏನ್ ಮಾಡ್ಬೋದು ಸರ್?
ಸಿಂಹನಾದ ಗುಗ್ಗುಲು ವರ್ತಮಾನ ಕ್ರಮ ಇಸ್ ದ ಬೆಟರ್ ಚಾಯ್ಸ್. ಏರೆಂಡ ಮೂಲ ಕಷಾಯ ಆರ್ ಗಂಧರ್ವ ಹಸ್ತಾದಿ ಕಷಾಯ ಆರ್ ಅಮೃತೋತ್ತರಂ ಕಷಾಯ should be regularly given. Don't give snehana to that person. If at all you want to give snehana, ballataka ghrutam or gugulu tiktakam ghrutam only can be given. Other snehana brahmana should not be given.
ಗುಗ್ಗುಳು ತಿಕ್ತ ಇದು ಇನ್ಕ್ರೀಸ್ ಆಯ್ತು ಸರ್, ಪೇನ್ ಜಾಸ್ತಿ ಆಗ್ಬಿಡ್ತಾರೆ, ಸಿವಿಯರ್ ಆಗ್ಬಿಡ್ತಾರೆ.
Google Tikta, it depends upon the company. Google Tikta contains Ballataka. So it is Amara Shotara. There should be Amalakshana. Then don't give any Snehadravyas. Only give.
Ampachana I have done already. Ampachana I have done so many times repeatedly, but still repeatedly it is happening.
You are talking about Jataragni Mandhyama. I am talking about Dhatvagni Mandhyama. When Dhatvagni
Mandya is good, Mandya is not there.
Not Jataragni, I am telling about Dhatvagni, Mamsa Dhatvagni, Snayu, Kandara, Sira Dhatvagnis are Manda. That's why Snehakalpa is aggravating. Then better is do Virechana with Avara Snehapana and do Kortashodana Virechana with Erenda Taila, and then Payasa Erenda Tailam repeatedly. Then think about Bahya Upakramas.
Okay, sir. Virechana I cannot do because 84-year-old.
No. Erenda Taila you can give with milk.
That we are giving. Erenda you are giving.
Erenda Taila you give.
Yes.
Because Dhatu Kshaya, Balakshaya, Mamsa Kshaya, Nadi Kshaya, the person is not responding. Only Bahya Upakramas are better.
Soil leopard done, but I am just asking for any rasayana, Vallatak rasayana or Karaskar
No,
rasayana.
not Vallatak Rasayana. Give Shilajit Rasayana.
Shilajit or Karaskar is also good, sir.
Karaskara old is not good. Shilajit Rasayana or Ashwagandharistam.
Okay. Thank you, sir.
Thank
Thank you.
you. Thank you.